A lot of people have never really thought about how we define poverty. It's a very important issue, and if we don't look carefully at it, we may very well miss a lot of what's going on. Now, there was not a formal definition of poverty until 1965. Let's talk about the origin of the federal definition of poverty, often called the poverty line, more often referred to as the poverty guidelines. These are numbers published by the federal government. Now, let's begin the story with Mollie Orshansky. She worked for the Social Security Administration, and she was the leading force behind developing these poverty guidelines. She worked on that in the early 60s, and they were made official during the presidency of Lyndon Johnson in 1965. Um, okay, let's take a look at what she did. Um, she relied on some research that had been done by the Agriculture Department in 1955, a decade before these guidelines were published. They took a survey. It's called the Household Food Consumption Survey. And that concluded that for families of three or more, the average cost of food for a week was about 1/3 of their total income after taxes. Now, how did they find out what food cost? Well, this is kind of amazingly low tech. The government hired people, they had employees who went out and went shopping in a supermarket in the Washington, D.C. area. And they had a standard supermarket basket of food. You know, it would include, let's say, mac and cheese and a gallon of milk and things like that. And they would physically buy these things and then add up the cost. And then they multiplied that cost by 3. And that was how much it cost to live for whatever period of time, if a week's worth of food, for example. And now since then, obviously we've had a lot of inflation, so the consumer price index has been applied to this figure to allow for inflation. And sometimes they would go out and redo the physical shopping trip. So that's the basis of the poverty guidelines. They're still based on that. From a formula that was arrived at in the 1960s based on a study that goes all the way back to 1955. Now, if you're starting to wonder about the accuracy of this, you're quite right to wonder. Let's look into that. First of all, what are the poverty guidelines? They change them every year. These went into effect in January of 2020. If you are a single person living alone, you are poor if you have an income below $12,760. Now that, believe me, you're not going to have a very, very good life in terms of physical needs for that amount of money. Now let's say that you have, you're a single parent with 2 children. Then, if you're below $21,720, you're poor. Anybody who's tried to raise 2 children on that amount of money knows that that is really fictional. Now, let's look at some of the other factors we have to take into consideration. One other point while we're on this slide. These are the same numbers for the 48 states and the District of Columbia. They recognize that the cost of living is higher in Alaska and Hawaii, so they have separate figures they publish for those states. But other than that, these are the same numbers for the lower 48 states. But anybody who's ever been there knows that the cost of living in New York City is very different from the cost of living in South Dakota. But these poverty guidelines don't take that into account. Now, there are arguments on both sides of this debate. A few people say, well, these poverty guidelines are too high. And their argument is they do not include public assistance such as food stamps. But these programs have gotten less and less generous, and that process continues during the Trump administration. Food stamps vary from state to state, and very often they're incredibly stingy, to be quite blunt about it, sometimes only a few dollars a month. Now, there are arguments on the other side that say these poverty guidelines are way too low. What do people who take this position say about it? Well, first of all, they're too low because people don't spend 1/3 of their income on food. It's really more like 1/6 of their income, and you'll see evidence later that, at least in some cases, by some estimates, it's more like 1/9. Housing costs more, transportation costs more, utilities cost more, certainly medical care does, and so on. So you would be hard-pressed to find a family that spends 1/3 of their income on food. Secondly, they're too low because they don't take child care expenses into account. That survey from 1955 studied mainly two-parent households with only one wage earner and one stay-at-home parent. And that means, of course, that since there's a parent at home, you don't have any child care expenses. But there are many, many fewer families that meet that description today. And finally, they're too low because medical costs have risen very sharply and are very unpredictable. The technology of medicine has exploded. That could be regarded as a good thing. There are more ways that medicine can serve us, but we don't have a system of universal health care in this country. And in fact, the trend is in the opposite direction. The Trump administration has a lawsuit pending to declare the Affordable Care Act, known as Obamacare, unconstitutional, with no plan to replace it. Okay, now why does all of this matter? Is it just a matter of an academic argument about what we mean by poverty? No, it's much more than that. There are 131 different federal programs that use the federal poverty guidelines, directly or indirectly. So if you want to be eligible for food assistance, for let's say Section 8 housing, for things like that, the federal poverty guidelines make a big difference. Now, some of these programs will say, well, if you're within 125% of the poverty line or 150%, then you're eligible. But when the government does that, it's really, in effect, admitting that those guidelines are too low. When they say, well, as long as you're within 125%, 150%, 300%, then you still are eligible for these assistance programs. But in popular belief and in a lot of political speeches, politicians and a lot of people still cite the poverty line. They'll talk about the poverty rate in America. And they often do that with no awareness of how these guidelines are calculated or even what they are. Okay, now let's look at a case study here of CHIP, the Children's Health Insurance Program. This is a program that has gotten good reviews. It provides health insurance for children. And it says that it applies to families making up to 300% of the federal poverty guidelines. That is not an extravagant figure. If you have a family of three and the poverty line is at 21,000, that means that you can get help from this if you're up to 63,000. Well, you can't afford health care to a great extent on an income of 63,000 a year. So this makes all kinds of sense that they would make the figure much higher. But the question remains, why would they keep that original guideline as low as it is? We'll get to that. Now, President George W. Bush vetoed this bill to create CHIP twice in 2007. He said it would steer the program away from its core purpose of providing insurance for poor children and toward covering children from middle-class families. And he didn't like the idea of government-supported health care. There were Republicans at the time who disagreed with him. They tried to override the veto. You need a 2/3 majority to do that, and they fell just a few votes short. If you want to see a little video on this, you can go to the PDF version, which is in the topics section. Now, these very low poverty guidelines have misled people into thinking that CHIP was very generous, that it was a waste of money, and in reality, there's no justification for that point of view. President Obama saw it differently from President Bush. He signed a very similar bill, and he created CHIP, which remains in effect 2 weeks after taking office in 2009. Now, what is the political motivation to keep that poverty line low? Well, if the government acknowledged the realistic extent of poverty, the percentage of Americans who are poor by a reasonable definition, then they would feel pressure to make safety net programs more generous. And a lot of politicians really don't want to do that. But almost nobody thinks it's even marginally possible to live a decent life within the boundaries of the poverty line. But nobody has had the political courage or ability to change it, because as soon as you open up that debate, the two major parties are at odds with each other, and they could not ever agree on what that new line should be. So what we've got as a result is a formula based on Mollie Orshansky's work back in the 1960s. Now, she lived a long life. She died in 2006, and later in her life, she even said, this formula needs to be changed. She was a person of goodwill, but by that time it was enshrined in law, and Congress was not about to take that on. This is a statement from the Oregon Center for Public Policy that states the problem, I think, quite succinctly. The bottom line is that the current system of measurement is outdated and seriously underestimates the count of the number of poor people in this country. If the government were to acknowledge the true extent of poverty, it would need to dedicate a greater share of its resources to pay the cost of programs to help the poor. It is unfortunately cheaper to use an outdated system of measurement so that fewer people will be in poverty by government standards. A lot of politicians are not willing to say, well, they're poor, that's tough for them, we're not going to help them, we don't owe them anything, and yet they don't want to put it that way. So they hide behind the poverty line. Now, there are other ways to measure this, and we have a couple here. Here are the URLs, and you can these are clickable from within the PDF in the topics section of the Mudge site. Let's take a look at the MIT Living Wage Calculator. A living wage is the concept of the amount of money you need to live a decent life. To have enough food, to have decent housing, to have your other needs taken care of, and so on. Okay, now this is from the MIT site. Unlike the federal poverty guidelines, It distinguishes for one part of the country or one part of a state and another. So here are the numbers for Wayne County, Michigan. Now, they also express this in terms of an hourly wage. So if a single adult has no children, a living wage, enough, they say, would be something in the neighborhood of $11.47 an hour. Now, what is the minimum wage? Well, in Michigan, it's $9.45 an hour. It was until January 1st of 2020, and as I mentioned in the note here, it has gone up to $9.65 an hour, adding $60 a year to the end result of this. But you have to realize that this assumes someone is working 40 hours a week for 52 weeks a year. And if they do that at minimum wage, they will earn $19,716. But there are examples of people working in hourly jobs, fast food jobs, things like that, who are laid off, whose hours are cut back. And that, of course, has reached the most dramatic extent during the COVID-19 crisis. But even apart from that, there is no guarantee that you can get 40 hours a week. In fact, a lot of employers will specifically avoid hiring somebody for that. The federal minimum wage is only $7.25 an hour. So the annual total is just over $15,000. Now, 32 states still have used the federal minimum wage because they don't have a state minimum wage that's any higher. If they do, then that overrides the federal level. But 32 states, a majority, don't do that. By and large, they are red states, Republican states. Now let's look at the bottom half of this screen. If you have two adults with two children, and both adults are working, which, if they're low-wage workers, they would have to do that. The MIT scholars have estimated that they would need $67,536 a year to be able to have a living wage, a decent standard of life. This is not lavish by a long shot. It's just the basics. So if you look at that circle down at the bottom, that's what it amounts to. And then at the top, you have very different needs for hourly wages depending on a family's circumstances. One adult, two adults with one working, two adults with both working, or no children, one child, two children, three children. But you'll notice all the way across the bottom, the minimum wage remains the same. It doesn't care how many children you have, for example. Now, these are very conservative estimates. You can be assured that if you have a family of four, an adult and three children, you are not going to eat like royalty for $9,000 a year, which you see there on this chart. Okay, let's take a look at how this squares up. Notice that a lot of these figures for an adequate living wage are in the neighborhood of 60,000 plus. But let's look at typical annual salaries, and these also are specifically applied to the Detroit area. The majority of these are under $60,000, sometimes well under it. You'll notice, for example, teachers, librarians, teachers' aides. Overall, they're making an average of $48,000 a year. Some make more, certainly, but many make less. if you are a healthcare practitioner, on average, this would include nurses, medical technicians, for example, you make around 66,000. That's not a lavish salary. If you're healthcare support, that would be something like nurses' aides, dietary aides, people like that. You're all the way down at 30,000. Protective service, police officers, security guards, 40,000. Food preparation is notoriously low paid. So think of the people serving us our lunches in our cafeteria. $21,000 a year. Building and grounds cleaning and maintenance, $26,000 a year. Sales people, retail sales, $27,000. So if you look at these typical salaries, they're nowhere near what you need for a living wage. Now, let's go to the other website. This is the Family Budget Calculator from the Economic Policy Institute. Now, the figure they come up with, I use the same configuration of 2 adults and 2 children, the same area. They come up with $79,000 a year. Now, notice food only represents 11.2% of those annual costs. So, the original formula that food should represent, 1/3 of a family's total expenses is wildly incorrect here. This represents about 1/9 of their total expenses. Now, a couple other comments on this. Healthcare is very unpredictable. Childcare is as well, and it's a major expense. And there's a 2-parent trap going on here. That if only one parent works, you can't make enough money. But if both parents work, then the majority of that second salary is going to have to go for childcare. So you're not very far ahead. But even if you're a few $1,000s ahead, a lot of families have to make that deal. Now, a word about taxes. A lot of people might say, well, poor people don't pay a lot of federal income tax. That's true for the most part. But realize that there are lots of different kinds of taxes. There are payroll taxes for Social Security, for Medicare. There are gasoline taxes and state sales taxes and property taxes. So even if you're a renter, some of your rent goes to the property taxes that your landlord is paying. So poor people pay a lot of money in taxes. It's usually a higher percentage of their income than it is for a lot of upper income people. Now, the reality may be even worse. Why? Well, first of all, we've made some reference to this. The annual income figures assume that 40-hour work week, 52 weeks a year, but low-wage workers can't count on that, and certainly gig workers can't. If you are middle class, if you have a salaried position, you're going to get your money like clockwork all year round. But wage workers, hourly wage workers can't do that. They can't base their finances on that. Another major problem is family breakup. If a member of the family dies, or if there's a divorce, that is financially devastating to a family. They may have purchased a house or a car or something based on the expectation that they had 2 wage earners, but what happens if they don't? Or based on the expectation that one of the parents was going to be able to do the child care, but if that's no longer possible, that's a crisis. Another, of course, is medical bills. They not only can create enormous amounts of debt, but they also result in lost work and therefore lost income. Now, these three factors here have been identified by Elizabeth Warren, who was a leading scholar of bankruptcy before her days in the U.S. Senate. And she has identified that these three factors are the three most common causes of bankruptcy. 90% of families who go bankrupt have at least one or more of these three factors.